It's very difficult to see data, let alone feel anything about it. Only when we connect it to real people does it start to matter. Nowadays, those people are living longer and requiring more long-term care. At the same time, budgets are being squeezed. Over the next few years, the NHS needs to find nearly 20 billion in savings, meaning doing a great deal more for considerably less. We know that quality of care cannot be compromised, and as no two patients are the same, what works for one patient's journey may not work for the next. Constant variations in patient pathways can put a strain on your budget and the service. As a commissioner, provider, clinician or manager, you'll probably be asking yourself, how can we maintain our clinical outcomes and deliver an appropriate service and manage my budget effectively? You know the answers are in the data, but how do we make it clear and useful? How do we turn all that information into an effective strategy? Like a prospector, we need to sift the mud away to reveal a nugget of gold. We've got to turn that wealth of information into a picture of where our money is going and how our patients are experiencing healthcare. When we can look through the numbers and see the patient's journey, then we start to get a clearer image. By comparing it to other patients' pathways, we see where variations occur. Then we start to understand where our money and our services are working and where they are not. IMS Visualise shows you the patient pathways graphically, plotting the various routes through treatment. It shows each pathway by specialty or consultant diagnosis, procedure or HRG code, including cost and length of stay. It allows you to see at a glance the pathway variations, and it can be easily added to any patient-level information and costing system. You can also zoom into a point of interest, like a particular treatment, event, or an individual patient event. So you can see variations and the cost associated with them, quickly establishing if the variation observed is appropriate or not. Think of IMS Visualise as the Google Earth of your data. You can hover at 5 kilometers getting an overview, drop into a local area, or see closely the detail of what's going on at ground level. It makes it easy to see where there's unnecessary expenditure and highlights patient groups who need more complex and costly treatment, ensuring you make the most of your capacity. It'll even give commissioners and providers clearer information when it comes to evaluating and negotiating contracts. Once the information is clearer, it becomes easier to compare and benchmark services. The strong visual evidence makes it simpler to present to other members of your team. And because any proposed recommendations are based on hard evidence, it encourages clinicians to become actively engaged, which is vital to the success of any changes. The IMS Visualise service is about much more than just software. It's a complete support package that will help you see data differently. If you'd like to see how, just visit www.seedatadifferently.com.